Who should take anesthesia and who shouldn't?
People who cannot make firm decisions should avoid the branch.
How do you keep yourself calm in some of the most challenging states?
You have to anticipate before anything bad happens. It does not come with 3 years of residency, it takes at least 10 years.
What career options do you think anesthesiologists have after an MD or DNP?
Pain and critical care, very upcoming in anesthesia.
What does it even mean to be like a freelancer anesthesiologist?
It is a bit chaotic.
What advice would you have to younger anesthesiologists who are dealing with a legal case?
It's only papers that are going to save you in court.
Have you encountered toxic work environment?
There are a few toxic people in every place that you work.
Physical attack. Have you encountered something like that? Hello and welcome to another episode of Behind the Scrubs by Knya. Today we are very lucky to have Dr. Jhanvi Bajaj. Dr. Jhanvi Bajaj is a gold medalist in anesthesiology from Tata Memorial Hospital. She is an accomplished teaching professor as well. Today, she has been an incredible support to lakhs of medical professionals across the country. And we are very lucky to have her join us today. Thank you, doctor, for joining us and spending your afternoon with us. We are very lucky to have you.
Thank you.
So, Dr. Jhanvi, could you start by telling us a little bit about your journey? You, of course, did your MBBS at GS Medical College. And then, of course, you're a gold medalist from Tata Memorial Hospital. Why anesthesiology? Tell us a little bit about your journey.
Okay, so I'm actually a first generation doctor and there is no doctor in my family, and I happen to take medicine only because of the conventional reason that I don't like maths and I didn't want to do engineering. So for me, the biggest achievement of my life was the day that I got an entry into MBBS, and that too in one of the prestigious colleges, that is St. GS Medical. And from then on, it was like I did not know that the journey is going to be so long. For me, it was just like, okay, I've entered MBBS, I'll come out as a doctor, that's enough for me. But as I studied over the years, I realized that there's a lot to medicine and it's a long way to go. And of course, I had not decided my specialty at all. But something very interesting happened in my life in the first year of MBBS. And that is, I started doing research, medical research. And fortunately, this research got chosen for a paper presentation in the USA. And I presented my paper. I got a third prize over there on an international platform just as a first MBBS student. And that was my first trip to the US, absolutely alone.
Got it.
And I love the place so much that I said, I don't know what I'll do in the future, but I definitely want to go back there and probably practice as a doctor in the US. And I started preparing my USMLE journey, which is supposed to be like a very different journey from the one of NEET PG. So you're supposed to have a very good CV, you're supposed to do a lot of research. I applied for national level scholarships in research, the Kishore Vaigyanik Protsahan Yojana, which is given by the Department of Science and Technology, the Government of India. And I got that scholarship and, I was all set. I did my electives at Yale and at Northwestern University. I got letters of recommendation. And then something happened which no one would have expected. And that is that I fell in love. So I fell in love with my current husband. And for me, it was just like, I know I'm going to go to the US and he's going to stay here because he was doing MS General Surgery. And he was hell-bent that he wants to stay in India. So I was like, this is just a one-off thing and, I'm going to go my path. But fortunately for him, the love was so strong. And the whole family welcomed me so well that I felt like I was torn in my final year of MBBS between pursuing my ambitions of going abroad versus staying back for love. And I chose to stay back for love. And then I had literally 6 months to prepare for NEET PG. And I had to scramble a lot and study because this was a completely different arena for me. Yeah. Preparing for NEET PG is very different as compared to preparing for USMLE. And finally, when the rank came in, I was in my love era and then, everyone was asking me, what specialty do you want to take? So I asked Amrit that what do you think would be a good specialty for me? So he said that I've always noticed that the anesthetist has a very good life because when he's in the OT, he's like, I used to keep looking that the anesthetist is getting scheduled breaks, they are eating on time, they are well rested, versus we are just working 24/7. So he said that, if I'm going to be so busy, I think anesthesia would be a good choice for you. So I would say I didn't make the choice, love made the choice for me to take up anesthesia. And I worked in the specialty for a week before getting in, and making sure that this is the choice that I want to do. And that's how I ended up at Tata Memorial, because I wanted to stay back in Mumbai. I have done my MBBS from here, and I wanted to stay back for MD too over here. And all that was on my mind was, नहीं मुझे तो शादी करनी है, मुझे तो बॉम्बे में ही रहना है. So I took up Tata, and that's where my journey started with anesthesia.
This is quite the love story and quite the start, and I think as the conversation evolves, I do want to come into the conversation of how your husband plays a part in, and how the marriage effects work and probably makes you a better doctor. But I'd like to stick to anesthesia for now.
Yes.
You've also pursued prestigious fellowships in neuroanesthesia and regional anesthesia.
Yes.
How is that kind of influenced your teaching, your clinical practice? Any thoughts and commentary on that?
Yes. So there is one thing that students always ask us before choosing the college in which they want to pursue their dream specialty. And that is that, ma'am, should I choose a government college or a corporate hospital? There isn't enough cutting or exposure in this hospital. And I am a very positive person. I take everything on the go, and I'm like, ठीक है, यहाँ पे नहीं है, किधर और हो जाएगा. So for me in Tata Hospital, we had a lot of cases under general anesthesia, and we had a lot of critical care. But unfortunately, we lagged on the regional anesthesia part, and I felt like it was an important thing to incorporate in my practice. So from the beginning, I had decided that whatever are the lacunae in my training, I will cover it up in my fellowships. So that is how I applied for the regional anesthesia fellowship. And neuroanesthesia, of course, I was highly interested in it, and I did those fellowships. So that is what I like to tell students too. Don't try to go into a residency which is going to teach you everything, because there isn't a residency like that. There are going to be lacunae in your training which you can make up for later in your fellowships. So this was the reason I took regional and neuro. And of course, it improved my knowledge, it improved my skills, and I was able to apply the same practical aspects in my teaching as well.
And as an anesthetist, I think it's a high pressure role compared to maybe other medical professional roles, right? And how do you keep yourself calm in some of the most challenging states in the OT, right? When sometimes you have a patient which is incredibly anxious, maybe there's a collapsing situation. How do you deal with it day in and day out?
Yes, so I think what really plays importance in this is two things. One is definitely your training. So as an anesthetist, we have been trained in different institutes that you have to anticipate before anything bad happens. So you keep, if you know there is a difficult airway, you keep your difficult airway cart ready. If you feel this is a difficult patient, you call for help. Okay, it shouldn't be on your ego that no, I will manage whatever it is. You should call for someone for help and keep. So anticipating is the most important thing in anesthesia, and that is what you're taught throughout your career. And that helps in reducing the anxiety that you have during that high pressure situation. And also it diffuses that fear, because trust me, those 10 minutes when you're giving someone anesthesia, you're literally paralyzing them, they are not breathing, and you have to give them oxygen. And if you can't, then I don't even want to think of that situation.
Yeah.
So that is something that you're going to be doing day in and day out. But if you have everything prepared, you have everything ready, you're going to be fine. The second thing is, yes, your personality also plays a factor in this. So if you're you're a very anxious individual, anesthesia would probably not be the best choice, because it is going to give you those moments of anxiety and moments of decision making on the spot. Like unlike other specialities where you have at least 1 hour, 2 hour to collaborate with people and ask them, okay, what should I do and how should we take care of this patient? In anesthesia, you literally have 5 to 10 minutes. So those two things, one is your training and one is your personality.
Got it.
And it does not come with 3 years of residency. It takes at least 10 years of practice, which will eventually help you develop both of them so that you become a successful anesthesiologist.
Yeah, super. Doctor, you've had the benefit of having experience in an Indian government hospital in a private government hospital, and a fair bit of experience out of India as well.
Yes.
How do the cultures, compare between these three? And what advice would you have to younger doctors who are looking at this video and being like, hey, you know what, this is what I want, or this is not what I want?
Okay. So I would like to talk about my education abroad first. So at Yale and Northwestern, which are supposed to be the best universities in the US, I noticed that they have these group meetings and team discussions and multidisciplinary teams. So everything for one patient is decided by a team.
Correct.
So the consultant is going to take the role of the final decision, but there will be a team who will be contributing, something like House MD. But in case of India, it is more of a hierarchy, which is now changing over the years. So in India, you have the consultant making all the decisions, giving the entire treatment protocol, and the juniors are just expected to follow up with it. So that is the main difference between working and studying abroad as compared to working and studying in India. Having said that, of course, in Indian government setups, you have much more chance to develop your skill as compared to abroad, because there it's not that easy to, because of litigation and everything, be in touch with the patient that much. So that is the main difference. I would say that the Indian corporate scenario is somewhere between the Indian government hospitals and the hospitals abroad.
Got it. Interesting. To shift a little bit here, to talk a little bit more about would you say is the most important personal milestone you've had till date, and something that you're really proud of achieving? As somebody who is spent so many years in medicine, taught so many students, what is one thing that when you go to bed at night, you're like, I achieved this, and I'm super proud of myself for doing that?
As I told you, being a first generation doctor, for me, just getting into MBBS was the biggest milestone for me. Because I still remember that night when I was 17 years old, and we had really bad internet at that time, and I called up my friend to check my results, and she was like, I've got a rank of 400, and I was like, oh wow, you will get an MBBS seat in Bombay. And I was just hoping that I'll get somewhere in Maharashtra, and then she's like, you've got a rank of 70, and I was like,
wow.
what?
Wow.
And then she's like, yes. And then I just woke up my parents, who were not at all, they're like, हाँ ठीक है, अभी BSc नहीं करना पड़ेगा. So that was their reaction. And then I was like, I'm getting directly into KM. So that was the biggest milestone for me. Of course, getting a gold medal in anesthesia was the cherry on the cake, but I don't think anything beats that moment in my life.
Yeah. I feel, while hearing it as well, I think you're completely, you're blushing and you're smiling.
Yes.
You can totally tell, right? I think
Yes.
you're reminiscing those memories, so it's beautiful. Switching a little bit to your teaching, what are some of the, often the pitfalls that you see students that, and some of the mistakes they are making when they're preparing for NEET PG, and probably a little bit of advice for them?
Yes. So, cut to about, I would say, 6 or 7 years ago, when NEET PG preparation was not governed by so many apps and coaching classes. We had a very straightforward NEET PG preparation. We used to attend any one set of classes for all 19 subjects, whether it's online. It wasn't online at that time, so just offline. We had one set of books. We had to just follow that. We had to trust whatever the teachers are telling us and keep revising it again and again, and eventually that would come in the exam. Of course, your MBBS preparation also matters in your rank, but the basic thing was you were trusting what the teachers were teaching you, and you were going ahead with that information. Now, with so many apps, with social media, there is literally an information overload, and the main problem is there is FOMO, major FOMO. So I see a lot of students who are busy the entire year just trying to collect sources, from every source. They're collecting PDFs, they're trying to get the PDFs or videos of every app, every book. And eventually at the end of the day, you're just sitting with a plethora of information, and you don't know what are you going to study from it. So the whole point is you have to place your trust in any one set of institute or app or your books, whatever you want to follow. Keep revising it again and again, and that is how you will crack the exam, because the topics have stayed almost the same over the last 20 years. The only way is how do you approach it. Second thing is, of course, time management, because now a lot of us, including me, guilty as charged, are on social media so much time. You're very distracted. and you don't have that much time to give in your schedule to study. You're busy doing other things. So schedule and making sure that you're following just one set of people and trusting them that they will get you through the exam is what is the most important thing.
So, NEET PG 2024 was delayed. NEET PG 2024 counseling was delayed. We don't know what's going to happen in 2025, but could get delayed again, unfortunately. What advice would you have for students who are sitting around and probably just hearing the night before the exam that, hey, it's delayed? That anxiety, the preparation. These are some of the brightest students in the prime age,
Yes.
right? What do you tell your students? What did you tell your students when they've kind of been through this?
So I always tell them it's very easy for me to say that keep a positive mindset because I'm not sitting for the exam the next day. Of course, you're going to feel anxious, you're going to feel angry, you're going to feel frustrated. But I tell them that this is just, the beginning of your journey. Imagine as a doctor, if you've asked for a set of tests which have to be done because the patient surgery is the next day, and you land up in the hospital the next day and you realize that, these major tests have not been done, or whatever you thought that the patient has revealed in history has not been completely revealed. How will you deal with that on the spot moment? And I was like, that is life and death. This is still an exam. It may be life and death for a lot of people. I mean, you treat it like that, but that is literally life and death. So these kind of game-changing situations are teaching you how to actually manage your life in the future. So take it positively. It's okay. Delay हो गया. मुझे थोड़ा पढ़ने का time मिल गया. So that's how you deal with it.
I think that is an incredible analogy, right? I think that's not just relevant for medicine, but that's relevant for life, right? That sometimes in the journey that we call life, often you're kind of thrown stones at, and it's about kind of figuring that out because it's like joining the dots or something
Yes.
later in life, right? So who should take anesthesia and who shouldn't, right? And how would you kind of structure that to somebody who is going to be making that decision?
So I would not answer who should take anesthesia because I feel like when my students ask me that should we take up anesthesia, I always tell them that for any branch, I would suggest that you go, you work in it for 2 weeks, you see if you like the lifestyle of that branch, if you like doing what is done daily in that branch, and do you see yourself doing this for the rest of your life. Who should not take anesthesia? Yes. So as I told you, people who are inherently anxious because there is very less room for anxiety in anesthesia. You have to be fully present in those 10 minutes of induction and extubation. And second thing is that if you're not very good at decision making, if you're always considering 10 things, so anesthesia is not the branch for you because you have to be a firm decision maker and you're making a decision on someone else's life. So you should be able to take that responsibility. So people who are generally not very happy being anxious all the time and people who cannot make firm decisions should avoid the branch because there are much better opportunities for them and much better branches for them.
Very fair. So today, if you're an intern and you are kind of not keen to take NEET PG, what alternative career paths could there be for them?
So my husband and me always discuss this, that we see so many medical bloggers now, like content creators and bloggers, and like in the last 5 years medicine has changed radically. I see a lot of MBBS students doing this. But yes, if you ask me about one branch, I would say medical administration is a very good branch. So you can get your MBA after your MBBS either from IIMs or ISB, and you can get into medical administration, the top corporate hospitals, and how to manage all the doctors. So that is one thing that you can do.
Interesting. I think that kind of opens up, right? So you don't feel completely boxed up into the traditional path.
Or you can join Knya Med.
We have a lot of doctors working for us, so absolutely. We are looking for doctors all the time. What career options do you think anesthesiologists have after an MD or DNB? Like alternative to the traditional?
So there are two main career options. One is pain medicine. Pain medicine is highly upcoming. So interventional pain techniques for like backaches, headaches, migraine, all of those, trigeminal neuralgia. And this is an OPD based practice. So if you see an anesthetist is rarely seen in the OPD. On the other hand, we don't have our own patients as such. Like it is the surgeon who gets the patients, and we are service providers to the surgeon. But pain medicine makes you a doctor who has his own OPD, own patients, and own procedures. The second option, of course, is critical care, intensive care. So it's open for both anesthetists as well as internal medicine people, and I see that there are a lot of hospitals in like the smaller cities which have attached ICUs. So the OT anesthesia part as well as ICU is being managed by the anesthesiologist. So pain and critical care very upcoming in anesthesia.
So I think freelancing as an anesthesiologist sounds super intriguing, right? And I know you've spoken about this a bunch, but I'll be very curious if you can share with our audience about how does it work, what are the pitfalls, what should people be looking for, what does it even mean to be like a freelancer anesthesiologist?
Okay, so to actually settle in my career, I was like, I need experience in all three domains. I've worked in a government hospital, I've worked in a corporate hospital, and now since the past 1.5 years, I've been freelancing. So, of what I've seen in freelancing, it is a bit chaotic because you just get a call at any time during the day that can you come for a case after 2 hours. You've not really seen the patient before, you don't know anything about the patient, you may be going to an absolutely new place with new equipment with no help. So the whole, I mean, someone told me this, that to be a freelancing anesthesiologist you need to have a lion's heart. You need to be very brave because you are literally going into a new environment every day. Having said that, freelancing gives you the freedom to be your own boss. So your timings are as per whatever you want. Like we had been trying to have a child for the past 1 year, and I wanted to cut down on my work. So I decided that okay, I'm going to work only 3 or 4 hours a day or do only one case a day. So freelancing actually did give me that kind of independence. I was my own boss, I was making my own decisions. Managing cases on my own gave me a lot of confidence, and of course monetarily also I would say freelancing is better than doing a job. And it's like, you want to wake up at 10 o'clock in the morning, fine, take a 12 o'clock case. You have something planned for the evening, fine, you can end your day at 3 o'clock. So it gives you a lot of freedom of choice. A lot of people will disagree with me on this because freelancers will say that we keep running from one place to other, but that is like, you have decided that you want to do more cases, you can work from morning 8 till midnight. But you want to do less cases, you can do less cases. So it's absolutely your own game.
If you're a junior in anesthesiology, litigation is something that could come up, right? It's a high risk profession. What advice would you have to younger anesthesiologists who are dealing with a legal case, or how do they preempt it and how do they prepare for it?
Yes, so litigation is something which India is becoming quite aware of in medicine now. There are again two important things that we have been taught. One is, as an anesthesiologist, your documents need to be perfect. So whatever is happening during the OT, I mean, now it's all recorded on the monitors, as well as you have to write your own documentation or enter it online. So make sure that you document everything that has happened during the OT. And that is something like, it's only papers that are going to save you in court. Second thing is, you need to have a good indemnity insurance. There are a lot of insurance companies, and if you are going to be working as a consultant, you need to have a good indemnity to back you up with a lawyer, with help. The third thing is, to be honest, just be proper in your practice. Give every patient adequate amount of attention. Don't be overconfident in your practice that I've done this 100 times and nothing's going to happen. No, treat every patient individually. If you are sincere in your practice, you will not land up in trouble. I would not say medicine as such is a complication-free branch. You see complications every day. You have to deal with the complication, but you should not be the cause of the complication. If you're not the cause of the complication, then the legal implications won't be anything on you.
Understood. I really appreciated something that you said early on, right? About that anesthesiologists are the surgeon's doctor.
Yes.
Right? And I think we've had many people sitting on your chair and spoken about the importance of social media, the importance of marketing themselves, the importance of networking. And we see many professions within medicine need to kind of market themselves, network themselves with patients.
Yes.
But maybe anesthesiologists do not need to do that. They're very good at their work. The surgeon will call them up and be like, hey, you know what, I want you to be part of my surgery every day, or part of the OT every day. Could you talk a little about that? Because I think that's a very important factor for introverts who are probably taking NEET PG today and going to decide what profession do they want to be part of, what specialty they want to be part of.
So there are, there's an annual session that I do on YouTube every time that there is NEET counseling, and that is why you should take up anesthesiology. I feel it's a highly underrated branch. People feel that you won't get enough work and you have to be dependent on the surgeon. And I tell all those students that this is one branch where you will get work based on your skills and based on how good you are to your patient. Your surgeon is going to just decide on the basis of, are you a good anesthesiologist at your work or not? He's not going to decide on the basis of have they advertised themselves, will the patients like them, and you're not really running helter-skelter trying to get patients for yourself, but you are trying to be the surgeon's best friend while he's in the OT. So my husband always tells me the best anesthesiologist is the one that you don't know is in the OT. Someone who is just sitting and watching your patient, is not running out of the OT all the time, and you're vigilant throughout the procedure. And if there's any complication, they will manage it quietly. You won't even know that there was a complication, that the blood pressure shot up or the heart rate has shot up. So that is what I feel is important in anesthesiology. And all this can be gained by your training. If I talk about a parallel branch like surgery or orthopedics, in those branches, you may be the best surgeon, you may be the best orthopedician, but you will have to go out after 10, 12 years of training, even training abroad, to market yourself. That, I have this center and I'm doing so many surgeries in it, which many people don't like. So there I feel like versus a surgical branch, I would rather go for anesthesia, where I am judged on the basis of my skills. I get work on the basis of my skills, and even if I have to improve something, I have to improve in myself. It's not that I have to go around telling people that I'm so good at this or that and vote for me so to get work.
No, superb. I'd like to shift gears a little bit and talk a little bit about work-life balance. So what does work-life balance mean for you?
Okay, so I would say work-life balance in the initial years of your medicine is practically non-existent.
Fair.
And in fact, I would say the harder you work to learn things at that point in time, the better doctor you are going to be. But going forward, you have to choose the kind of life that you want. So I was sure that I want to teach as well as continue as an anesthesiologist. So how I manage my day is I do my cases in the morning from about 8 to 2. And then I come back home, spend some time with my parents and with my husband. And then in the evenings, I generally have a 1-2 hour class. And I keep the weekends reserved to go out with friends. So if you have a sort of set schedule, you can manage around it. I also do go for offline classes all over India. So those are the times where I have to sort of give work more priority and life less priority, because I'm away from home for 2 days. But I keep that to like once or twice a month. So I spread out the classes all over the entire year. So I think work-life balance is something that you can develop over a period of time once you know what you want in life.
So 2 follow-up questions. Do you think work-life balance as a woman medical professional is different? And if so, why?
Okay, so as a woman, I think there are some extra things that you need to do, like take care of the house, take care of the children. But I feel like if you develop a support staff around you, you're able to manage all of these things very well. I'm fortunate enough to have my in-laws with me. My mother-in-law is extremely helpful. So while I'm at work, she manages the house. I do have friends who stay just, like husband and wife. So they have set like their staff to be there, to, someone to cook, someone to take care of the house. When it comes to children, hopefully I will be able to answer that next year. But I feel like as a woman, you also have to take some breaks in your career whenever you have small kids. But those are the things that I think you live for. Like, why are you working? Why are you earning? You're doing all that just to spend some time with your loved ones. So yes, you have to sacrifice, but I think that if you take that sacrifice in a positive way, that yes, this is something that is worth spending time on in my life, then you will be happy about it.
Do you think some branches in medicine are more conducive to work-life balance than the other? Right, I think you've spoken about this in the past as well, that anesthesiology gives you that support to kind of be flexible with your working hours, where you can start at 6 a.m. and end at noon and have the rest of the day to yourself, right? Whereas maybe an OBGYN, you're going to get a call at 3 a.m. and you have to be prepared, right? So how do you think of that, and how should younger medical professionals think of that?
Yes, so I see a lot of medical students who have just entered MBBS and thinking of the branch that they want to take, and the first thing they say is, I want work-life balance. So I'm like, no, till you finish your training, you have to accept the fact that you are not going to have work-life balance. On the parallel, you will have friends who will have corporate careers, who will be climbing the corporate ladder, getting promotions, going for these multiple trips and weekends off, and you have to be okay with all of that. Having said that, I feel like later on in life, when you have a set schedule, like that you have to go for your job from 8 to 4, you will be able to manage other things in life as well, like social commitments and stuff. Talking about the branches that you are talking about, like even it's completely something that you choose. Like if there is an OBGYN and they want some time for themselves, like they want work-life balance, you can actually choose a branch as a fertility specialist. So you don't have to be available for calls. Another thing is, as you become more and more senior, you can leave the emergency calls for your juniors to be done. So you have to build work-life balance. It's not something that will be gifted to you by your branch. But having said that, for anesthesiology, it's easier to get the work-life balance much earlier on in life. I would say immediately after your residency, because we have this shift system. So there are a lot of hospitals which call anesthesiologists in shifts. If you're doing a morning shift from 8 to 1, and then you can go home, and then the afternoon shift people come from 1 to 8. So you have a schedule set. And that's why I love anesthesiology. I keep telling everyone that you should take up anesthesia. You can decide your life.
Shifting gears to something a little bit more, I would say morbid rather, have you encountered a toxic work environment? And something that is really deep to our hearts at Knya is that, medical professionals face physical attack time and again, right? And we're not seeing it reduce. Have you encountered something like that, and how did you handle it?
Okay, so actually I would take these as two questions. First, about the physical attack, I haven't encountered it, because as an anesthetist, you're not at the forefront, you're not dealing directly with patients or patients' relatives. Of course, if there is a untoward complication, you have to talk to them and be a part of the team. But I do remember that working in the ICU at Tata Hospital, there was always very, very good security that was there outside the ICU, because that's the most delicate area of the entire hospital, and we always felt safe. The security was there 24/7, and I think in a lot of corporate hospitals too, they know some areas like OT areas, ICU areas, OPD areas, where they do have stationed security guards. Talking about the first part of your question about a toxic work environment, I would say that there isn't a toxic work environment as such. Maybe I may be wrong, but this is from my experience. There are a few toxic people in every place that you work, whether it's a department or even if you're working with a particular surgeon. You just have to grow up and learn how to navigate your way around those people. So instead of, saying that this person is toxic and I don't want to work with them or I don't want to deal with them, you have to learn how to navigate your way. And let me tell you one, this may sound very childish, but one way to please everyone, every doctor, is to feed them good food. Because my mother-in-law sends like the best dabba every day to the hospital, and I will be always inviting people, come home, eat, or come have my dabba. And even the people who are, relatively rude to you will slowly start softening up.
I guess that's
you always have to take into account that as a medical professional, you're under a lot of stress. So maybe that person may not be angry or irritated that day, but they may displace it onto you. So you should know of ways to diffuse the situation. Of course, if it gets too much, you do have authorities to speak to that whatever is happening is not
Yeah.
right. But I have rarely encountered that. I
No.
would say that there are no toxic people. Maybe they just have bad days.
Yeah.
And even if there are, then you have to learn how to work around them.
Yeah, yeah. So, we've spent a lot of time at Kanya actually talking to medical professionals, administrators, and one thing that we've kind of figured out is that one of the reasons for the attacks that happen towards medical professionals, it kind of stems from a systemic issue of a lack of preventive care
Yes.
measures,
Yes.
right? In particularly our community centers, maybe in tier 3, tier 4 cities, where we are not focusing as a system to kind of prevent,
Yes.
right? So when patients actually come to the ICU or the emergency room, the disease is at such an late stage that there's very little that a doctor can do.
Yes.
Right? And that's what kind of leads to like a bit of the patient getting flustered. Maybe there could be extra pressure on the doctor so they're not able to communicate effectively.
Yes.
What are your thoughts on this? Have you seen something like this before?
Yes, so I have seen this a lot at KEM during my internship, and there is something, like small things that are taught to you as an intern. In fact, it's a part of our training program that happens in the beginning of the year, and that is they say that you have to deal with every patient differently. Like if you see that there is an old morbid patient who's being brought to you in the casualty and is probably not doing well, the family is probably more accepting of the fact because of their age and disease. But if there is a young patient who's probably had poison and come, so there is a different way of dealing with those kind of patients. Those are the ones that go to the combative stage. So from the first stage itself, be humble and polite. Don't start yelling and shouting at the relatives that why did you take so much time to get them, because even they are in that chaotic situation and they don't know what to do. Second thing is, when they come in, always explain the prognosis. Like communication is key in these kind of situations. You let them know that patient is in a serious condition, we are trying our best, and keep them in the loop. Don't just take the patient inside the ICU and then give no message at all for the next 4-5 hours, and then suddenly go out and say that oh my god, we couldn't save the patient. So communication is key. Keep talking to them, keep them in the loop. What are the things that you're doing? And of course, put yourself in their position. Like they have a healthy adult walking in and then suddenly bad news being delivered to them. It's going to come as a shock, and that shock is going to be displayed as anger, because there's no one around. Maybe the anger would come out on you. So if you talk to them politely, if you explain everything well, if you explain everything time to time, you can diffuse most of the situations. Another thing that I really believe is that in every center that you work, you should know that you should, for your own security, there should be enough security guards. You should have probably, this is not possible actually, to always have friends close by, but you should know whom to contact in case of help. If someone is turning violent, there are codes. You can call people and let the security room know that we may need some help over here. So call them on time. So that is something that the hospital should provide.
Yeah. In addition, would you like to add any other particular steps that maybe hospitals administrators should take for women's safety, women resident safety, late night shifts, anything particular that should be adding that's missing in government hospitals today?
Yes. So listening to all the events that happen all over India, especially with a lot of recent things that have happened, there was one thing which I felt would have made a lot of difference was, and especially we follow this quite a bit during my residency too, is that when you are keeping a girl for night duty, you make sure that there are at least 2-3 other girls who are kept for night duty along with them. Okay, so like if you need 3 residents on duty, make sure that there are 2 girls and 1 boy, or you can have all 3 as girls, because eventually during the night duties you're also sleeping in the side rooms, or like whatever accommodation is provided. So if you have someone else in the same room as you, then untoward things, I wouldn't say cannot happen at all, but yes, you have someone with you, so you can raise an alarm. That is one thing, and there should always be a security guard outside the women's hostel. I have faced situations in the past where people have behaved badly, misbehaved, like people coming from outside, not in Mumbai, but I was working in a smaller area for my bond, and there were just these two random guys who came on a motorcycle, and they were miscreants. And I did complain to the security, and the next day I had police in the hospital, and the number of guards had increased.
Yeah.
So those kind of immediate actions
Yeah,
need to be
of course,
taken.
Of course. If you could trade your life with one person, who would that be, and what would you want to learn?
I think with you.
With me? Oh, wow. Okay.
Yes. Because I have always had this thing to do something new, to start something of my own. And I feel like you've reached a very good stage starting Kanya. And then, like in just the last 2-3 years, I have seen the way you all have grown. And I would love to have something of my own. And I think that's a culture also nowadays, to have your own startup.
Yeah.
So I would love to do that. Love to see how life is as an entrepreneur.
Thank you so much. I am flattered, but whenever you want to start up, I'm all yours to share as much as I can on the journey. It's been a very, very fulfilling journey, I think, with Kanya. I think, particularly, I think because our jobs are attached to a mission of supporting medical professionals, celebrating them, it makes the journey so much more worthwhile. It is a very tough journey, right? With many, many downs.
Yes.
But it's a net positive, and we love what we do. So, thank you.
It's something that you're actually building on your own. It's like having your own child. It's your
Absolutely.
Kanya is your baby.
Absolutely.
So I would love to do something like that.
Yeah, absolutely. I didn't expect that, but so for postgraduate education, I think today we're seeing a fair bit of, I would say, fashion of medical professionals wanting to leave India, right?
Yes.
And maybe even for MBBS, right? What advice would you have to kind of these students, and what factors should they weigh before making a decision like this?
Yes. So, of course, medical education abroad is much different from that in India. But I would like to say that don't just focus on the career or the education part. Also think about how your life in and around your career is going to be. Like when I was going to the US, when I did these electives, it really gave me that insight that I will have to manage everything on my own. I'll have to manage my own house, I'll have to cook on my own, clean on my own, which most of these things we don't end up doing here in India. And I was absolutely okay doing all of this. But when it came to the fact that I may have to start life from scratch, find a life partner, hopefully have someone who will support me through the entire process, that is when I started faltering a little bit, and I was like, I think I have someone back home who would be very supportive of all my dreams throughout my life. And then that is how I took the decision that this was an individual decision, but for me it was like, I don't want to start my life from scratch. I have my family, I have my husband back home, so that is how I want to follow it. Having said that, a lot of people start their life afresh abroad. It's great from career point of view. You have excellent work-life balance. I have friends both in UK, US, and also some friends in Australia, and they're doing very well. You're given very fair opportunities to grow abroad.
Yep.
You're skillful, you're hardworking, you will grow. They are extremely happy doing that. And yes, they are managing their family life also along with it. So it's a completely individual decision, but I would say before taking a major life decision like this, go for 6 months in a different country, see if you like it, and then make the decision.
Being married to a surgeon, right? How the dynamics at home, and any advice to other, medical professionals who might be married medical professionals as well, and an anesthesiologist and a surgeon at home, how is it?
So I would never say don't take your work home, because it inadvertently does come home. It's very nice being married to a medico, because you get to discuss your daily life, and they also understand the perils of your branch. Like as an anesthesiologist, someone may call me for a case which would last for 2 hours, but then something happens and it goes on for 6 hours. It would be difficult to explain that to a non-medico, and for a surgeon, he'll be like, why is he doing this? Tell him to do that, then this will get done faster. Or even if sometimes, like complications arise, or I want to know what are the steps in the surgery that I should be careful as an anesthesiologist to be more vigilant of, I can always turn to my husband and ask him those things. So it is very nice to be married to a medico, because you're literally living your personal and professional life together, and you get a lot of advice on the same from your partner
Yeah.
and understanding.
Yeah, I know. We are also a husband-wife business, so I totally understand it, right? And I think
Yes.
work always comes back home. It never not comes back home.
Yes.
So I get that.
In fact, if work is coming back home, I believe that you're doing well.
So what does a typical day look like for you today, right? Now that you're an educator, I think you have a thriving practice, you're kind of so busy at work, you have a home as well, you'll be building a family soon as well. So how do you kind of, what does the day look like, and any kind of tips and, tricks for anyone who's kind of, struggling with managing personal life and a bit of their profession as well?
Yes. So a typical day starts, I think I leave home at about 7:30, because most of the cases start early. I do all my cases from about 8 o'clock to maximum 4 o'clock. I try to keep it till 4 only, so that I have time to teach. Once I get back, of course, meals and everything are at work. And once I get back home, I take a couple of hours break around till 6 o'clock, and I usually schedule my classes. So I'm a part of Cerebellum Academy, which is for NEET PG students. I teach anesthesia over there. And I'm also a part of Conceptual Anesthesia, which is an app exclusively for anesthesia postgraduates. So once you've entered anesthesia, you don't have to, like scramble for where should I study from, what is anesthesia, and how do I build my life around it. This app takes you throughout your residency. So conceptual anesthesia or cerebellum classes usually are in the evening at around 6, and they can go on till 8, 9. And then after that it's dinner time, and then spending time with family. So it's pretty much like that. And of course we keep the weekends, we don't keep it off, because as a doctor you don't really have Saturdays off. You can take Sunday off, but weekends we generally end up spending with our non-medico friends to see what is going on in their life, and to have a fresh perspective of life.
Fair. And final question, I think you spend so much of your time teaching, and I think giving back. If today you're, just got done with residency, and you're kind of thinking about what your life looks like post-residency, and you want to spend some time, giving back, teaching, how should you think about it? How should you go about it? Should you join one of these institutes? Should you probably start teaching a little bit on social media? How should they think about it?
So if you want to start teaching, I think the best place to start teaching is on YouTube. So you can make short videos, you can put it up on YouTube. That helps you build your name, it helps you build your brand. People know you, people can see how well you teach, and that is literally how I started. And then you get picked up by coaching classes or institutes who see your videos over there. Because traditionally, if you see the teachers, if you want to teach in an institute, they would ask you for a sample video. Now they just go online and see that, okay, this is how she teaches. And then one thing leads to another. Like I started off with an academy, and then I was a part of conceptual anesthesia. Now I'm a part of cerebellum. So one thing leads to other. But if you want to know like how your profile has to be built, A, on YouTube, B, on little like shorts on Instagram. And those are the two main platforms.
Super. It's been a real pleasure. We will end with a quick and fun rapid fire.
Yes.
And then we'll obviously be open in case you have any questions for me about my journey about Knya. Would happy to answer anything that may help. So let's start. Coffee or tea before a long surgery?
Red Bull.
Red Bull. Oh wow.
Because you're saying long. You may think long is 6 hours, but no, long is 20 hours.
One word to describe your MD journey at Tata Memorial Hospital.
Long yet sweet journey. I would take 3 words. Long yet sweet. Because the hours in Tata, considering it's a cancer hospital, most of the surgeries used to be quite long, from morning to evening. So literally at least 12 to 14 hours spent every day.
Well, favorite medical TV show?
House MD.
What's the most underrated skill every anesthesiologist should have?
Decision making on the spot.
What is the longest surgery you've been part of?
20 hours. It was actually a surgery for ovarian cancer. It's called HIPEC. I mean, it started at 8 in the morning and it got over the next morning.
One myth about anesthesia you wish other people stop believing.
That it's a dependent branch. You're not dependent on anyone except your own skills and the way you work. You're not dependent on anyone else.
If not anesthesia, which specialty would you have chosen?
Dermat. I was highly interested in the cosmetic
And then love
part of
happened.
dermat.
And then love happened.
Yes.
The most challenging case you've handled so far?
I think this 20-hour case, because after I would say 14 hours, I was really exhausted. But then we had a very good team who, helped us, supported us for the remaining 6 hours.
A surgical specialty you love working with the most?
So I would not say surgery over here because there would be a bias, but orthopedic because I have done my fellowship in regional anesthesia.
Correct.
So I like working with orthopedic surgeons a lot.
One thing that instantly calms you before a high pressure case?
Being well prepared. As I told you in freelancing, there are a lot of situations where I'm going to new places, having to deal with new equipments, no help. So if I'm a little skeptical about the place, I go, I inspect it once before, I see that everything is there. If there are certain things that are not there, I carry it in my bag, I carry it in my car. So being well prepared is important.
If you could work in any other country besides India for a year, where would it be?
Probably the US because I have seen the system over there and I think it's a very good system. So probably there.
Anesthesia in one sentence, go.
Highly underrated but supremely rewarding branch.
Super. Well, doctor, it's an absolute pleasure to have you on Behind the Scrubs. I really appreciate you taking out the time. Anything that you'd like to cover that maybe we haven't covered today or any questions you'd have for me, happy to answer as well.
I think I would like to ask you about your journey at Knya.
Yeah.
Not in one word or 3 words, but maybe in a few sentences.
So it's been 3 years that we've been doing this. I co-founded this with Vanshika, who's also my wife. And Vanshika has a deep background in textiles, and I'm the generalist in the relationship where I take on kind of finance and accounting and hiring. And it's been one of the most beautiful journeys of my life. Right? I've worked for many years before this as well, but having the opportunity to work with medical professionals who are coming to work every day, saving lives, alleviating pain is very joyful, right? I think we've around more than 7 to 10 lakh people wear our scrubs every day across the country, right? And a day doesn't go by where we don't get a message or somebody slides into my DM being like, hey, you know what, I wore your scrubs on my first surgery. I wore this in my 10th surgery, my first root canal. Vets and physiotherapists and surgeons and OBGYNs across the board, right? And I think we go to work every day just really, really happy with what we do. And it's not been an easy journey, right? It's been very, very difficult, right? Problems come up galore, right? Building the team, financing, operations, customer service, these problems keep coming. But at the end of it, when we know that the impact is there, it makes us feel better about it, right? And it makes us feel happy. And, it's been 3 years and we've been able to build this brand to be one of the leaders out there, right? And getting a chance for me to interact with people like you, senior doctors like yourself, understand your journey. It's been phenomenal. I could not have asked for more. And I think we have bigger visions. We are, hoping to do even more. So let's see. I think fingers crossed how the journey evolves. But yeah.
But when anyone has a startup, the first question that they always have at the back of their head is, what if we fail?
Yeah.
Like, what if we are not able to take it off and all the investment fails?
Yeah.
Did you guys ever think of that, and how did you navigate around?
So I'll tell you, right, and kudos to Vanshika here, right? She started Knya.
Okay.
And she was kind enough for me to kind of join the ship when it started working.
Okay.
Right? I was doing 2 jobs. I was in private equity and I was helping Knya. And she was full-time in Knya. So she really took the risk first. Right? Being a husband-wife business, we were like, how can we both just leave this and do this, right?
Yes.
And I'll tell you, in the early days, we absolutely were very nervous. We're like, what happens? How will we pay payroll?
Yes.
How will we pay salaries? How will we deliver orders on time? How will we pay vendors? Right? And I think it's about just believing in the idea and kind of seeing smaller and smaller signals, having discipline. Right? I think as a founder, I run working capital very, very seriously. Right? I think, can you pay your vendors on time? Can you pay all your bills on time? Are you collecting your money on time? Simple things like that. And once you build robust systems in place, kind of gives you confidence that, you can scale this business. right? And once there is customer love and the same customers are coming back, and what we've seen in Knya, right, where majority of our revenue comes from repeat customers, right? Then you give confidence that, you know what, you're up to something, right? But the early days are very challenging. It's the most difficult thing. And the fear of failure is very real. Imposter syndrome is even more real. Like, can I do this? Like, why am I geared to do this? And you rightly said, we aren't even doctors, right? Like, yes, we've come from a family of doctors and we've spent we've spoken to like tens and 20,000 doctors, right? So we have a very unique insight to the medical professional world, which I honestly feel sometimes that doctors also don't have, right? True. Because I've got a chance to have conversations with anesthesiologists, pulmonologists, physiotherapists across the board, right? But it's been a unique journey, a tough one, but a very, very fulfilling one. Thank you so much, doctor. Really, really appreciate you coming on a Saturday afternoon. So thank you so much for tuning in and watching Dr. Jhanvi Bajaj. I've learned so much from this conversation. I'm sure you will do it as well. Take a moment to like it, to share it, and to subscribe the page. We will also have all the details of Dr. Jhanvi Bajaj in the description, so you can feel free to reach out to her, contact her for advice or any support you may need. Thank you so much.